You are eating less, exercising more, and yet you're gaining more weight. Could it be your thyroid? Maybe. In this episode of Thyroid Awareness, so we've been looking at the various thyroid disorders. And in the last episode, we looked at iodine, which is the raw material for thyroid hormone. You know, thyroid hormone is produced by the thyroid gland, a gland that is located in your neck. So it's somewhere, covered by some muscles. Welcome to 24/7. Also, bring those of us to it. Welcome back to 247 Health Matters. I'm your host and your health coach, once again, Dr. D. It's a pleasure to be with you. Today, we'll be looking at underactive thyroid, or what is called hypothyroidism. It's one of the major and very common thyroid conditions, and it's very, very important that we should look at it. In order for you to understand underactive thyroid, you need to know how thyroid hormone is produced by the body. The last time we looked at iodine, which is a major raw material for thyroid hormone production. Another very important raw material for the production of thyroid hormone is thyroxine. So thyroxine is a very essential amino acid. So this thyroxine and iodine are coupled together in the thyroid gland to produce thyroid hormone. Depending on how many elements of iodine is complex to the thyroxine determine what kind of thyroid hormone you produce. So if there are 3 molecules of the iodine, you call it T3. If there are 4 molecules of the iodine is complex to thyroxine, you call it T4. The thyroid hormone, T3 and T4, are produced under the influence of another hormone or chemical that is released from the master gland called TSH. So the word TSH means thyroid stimulating hormone. So if you look at it, that means it's an hormone that stimulates the thyroid gland. So the question is, somebody recently asked me that where is the thyroid gland in the body? The thyroid gland is located in front of your neck. So as a matter of fact, just by the side of your windpipe. And it has 2 lobes connected by what we call the isthmus. These 2 lobes are connected by the isthmus. Now, the thyroid gland, like I said, is under the influence of an hormone called the TSH. So when the thyroid hormone is released in substantial quantity, enough for the body, it goes back, it feeds back to the master gland, which is the pituitary gland, to say, hey, I have enough. Otherwise, it will just continue to stimulate the thyroid gland, and the amount of thyroid hormone in the body will be in excess, and which also is not good for the body. Because if you know what thyroid hormone does in the body, it controls metabolism. That means the metabolism will be too much. So this regulation is very necessary. So let's go to underactive thyroid. So underactive thyroid occurs when the amount of thyroid hormone in the body is too low. So the T3 and T4 are low. That is when you say the individual has thyroid, or rather hypothyroidism or underactive thyroid. And of course, this is usually accompanied by slow metabolism, just like I said, because one of the major effects or major function of thyroid hormone in the body is to regulate our metabolism, our means of energy expenditure. Now let's talk about causes of underactive thyroid. There are so many, but the commonest is autoimmune disease. So the word auto means self. Immune means your soldiers, soldiers in your body, your immune system. So when your immune system recognizes any tissue as foreign to itself, it will attack it. And that's what happens in this instance. So as a matter of fact, the immune system recognizes the thyroid tissue as foreign and it begins to attack it. And as it attacks it, the volume of the thyroid, the capacity to produce thyroid hormone begins to diminish. And when it diminishes, it leads to what is called hypothyroidism or underactive thyroid. So the commonest cause of this is a condition called Hashimoto thyroiditis. From the word, when you hear the word itis, in medicine, it means inflammation. So there is an inflammation of the thyroid gland that is as a result of an autoimmune process. So it is named after a man, a Japanese, called Hashimoto. So the next, also equally very important cause of underactive thyroid is iodine deficiency. And of course, sometimes also iodine excess. You remember the other time I told you that excess of iodine also can lead to underactive thyroid. The next also is after removal of your thyroid gland. I mean, if the thyroid gland is taken away, that means the source of thyroid hormone has been taken away, so your thyroid level will be low. The next is another means of treating overactive thyroid, which is radioactive iodine. So this radioactive iodine treatment, it's one of the ways of treating overactive thyroid. So sometimes when you give this treatment, the thyroid gland will shrink in size, and of course it will also nuke almost all the cells. And when it nukes the cells, it will deplete it of its thyroid stock. The last but not the least are some medication. There are quite a number of them, but common is lithium that is used for a condition called bipolar affective disorder. There are so many other medications for cardiac, cardiac patients like amiodarone. Quite a number of them. I will be able to go into the details. So how do I recognize someone, an individual that has underactive thyroid? The symptoms are generally non-specific. Many of them will be fatigued, they'll be tired, they'll complain of muscle ache and stiff joints. They will be gaining weight in spite of the fact that they are not eating much. And of course, they may have sensitivity to cold intolerance. They may be constipated, they may be depressed, have a foggy brain. They may, especially in women, also menstrual irregularities and infertility. So the next question is, who is at risk here? Like I told you, it occurs more commonly in women, especially women above the age of 60. Another instance is those who have family history of thyroid disease. They are more likely to have underactive thyroid. And those who have family history or history of other autoimmune conditions like type 1 diabetes, like lupus, of course, pregnant women also are at risk. Most labs now, they flag or they put red flag on results that you have. And when you look at it, you notice that your T3 and T4 will be low, but your TSH will be high or may be high. Now, the question is that why is the TSH high? The reason is because the TSH is trying to compensate. Remember that T3 and T4 is low. So your master gland, pituitary gland, is trying to flog. It's trying to flog the thyroid gland and say, hey, I don't have enough. And while it's doing that, it's secreting more, because the level of thyroid hormone that is reaching the master gland is very little. So it's like, my friend, I don't have enough. And then the master gland releases more thyroid TSH in order to compensate. But while it's doing that, the level of the TSH goes higher and higher. I cannot overemphasize the importance of a proper testing, because quite a number of the laboratories we have now do not have good quality control. So, and the kind of results they churn out are misleading. And as a matter of fact, many people have been treated wrongly for the wrong condition. So how is underactive thyroid managed? It's usually treated by giving thyroid replacement, because that is what is lacking. So your thyroid replacement, the name of the medication that is usually given is called levothyroxine. And it should be given at a particular time in relation to your meal. And you need to stick to this very strictly, because if you don't, you may have issues. For example, if it's going to be taken in the morning, you should take it with a full glass of water about an hour before your breakfast. If you are not able to take it in the morning and you want to take it before bedtime, then make sure that it is done at least maybe about 4 hours after your last meal. You also need to avoid taking certain medications along with your levothyroxine, things like antacids, because acid is necessary for the absorption of your levothyroxine. Other medicine you should not take along with it are calcium and iron, because these also prevent the absorption of levothyroxine. So very important. So it's not something you just take anyhow. You need to be intentional and deliberate on the timing, and you need to be consistent about the timing. What if you miss a dose? No problem. Just make sure you take it at the next time you remember. Other important consideration here are kind of food that interfere with absorption of levothyroxine. One is coffee, soy products, and of course high fiber diet. So you need to consider this when you're taking your levothyroxine. So let's look at some other things you need to limit, maybe you take in moderate proportion or maybe avoid. For example, there's what they call the cruciferous vegetables. They're very common in the market: broccoli, cauliflower, kale, cabbage. I mean, these are very good vegetables, where it's been shown that they actually interfere with iodine absorption by the thyroid gland. So it may complicate underactive thyroid condition that you have if you're taking them. Having said that, maybe you're the type that you love these vegetables so much, I mean the cruciferous vegetables. What you can do is to cook or steam the vegetables, because it's been shown that when you do this, you reduce the impacts of the compound that is responsible for the interference with the thyroid hormone. So that's a way around it, or you limit the quantity that you take per time. Other food that you need to be aware of, and you need to limit their consumption because they actually interfere with thyroid hormone production. They include things like millet, flaxseed, and there are even some fruit like strawberry, pears, and peaches. They all have been implicated. Also, fatty food, sugar, also beyond the fact that they also interfere with thyroid hormone production, they can also contribute to weight gain. So you should limit them when you, in the setting of underactive thyroid. Finally, alcohol. You also need to limit your alcohol consumption because alcohol has been shown to suppress the body's ability to use thyroid hormone. So please, very important also that you limit the amount of alcohol you consume. This brings me to the end of this very interesting topic on underactive thyroid or hypothyroidism. I believe you've learned something that you can share with someone. Please like, share, subscribe to our channel, and please also hit on that notification bell so that you can receive more interesting topic or content from us. Till I see you next time, I remain your coach and your friend, Dr. D. Stay healthy.